that mental health issues are common in the first trimester and the third trimester as compared to the second trimester in the pregnancy. That is what I'll be talking about today, especially postnatal depression. I am Dr. Josephine. I do mental health videos and that of self-improvement. Welcome to my YouTube channel. Just in case you stumbled on me today, please remember to press on the subscribe button, book the like button, and share to your loved ones. When people give birth, what actually happens is that a lot of people can have depression during, before, and after pregnancy. All this is generally called perinatal depression. And maternal depression generally has an adverse outcome in pregnancy, like a premature delivery, or even after the delivery of the child. It has effects on the child's emotional development. And if you don't know about it and quickly get it sorted out, you be at a disadvantage. And this is the information I'm giving across to you today. Postnatal depression is a depression which one have the feeling of sadness, worthlessness, hopelessness, low mood, and loss of interest in pregnancy, especially within the first 1 year of delivery. And what happens is women get so saddened and unhappy and has similar characteristics of depression that I've ever mentioned. I've done a video about, which was uploaded some time ago. You can actually go back and have a look at it. During pregnancy, it is called antenatal depression. Like you go for your antenatal treatment, antenatal discussion just before you give birth, and they give you periods to come. That is cause any depression that occurs during this period is called antenatal depression. And any depression that occurs, any feeling of sadness, low mood, as I discussed in my earlier video, after delivery of the baby is called postnatal depression. Even occur as fast as 72 hours. And what do you experience? You experience low mood, low energy, lack of interest. And if it gets bad, and something we call the postpartum psychosis, you start feeling that your baby is a burden, or your baby is malfunctioning, or your baby is malformed, and or is a distress to you, or is evil. And that's why you hear people trying to kill their child, and lead to a serious case called the infanticide, where they kill their baby because they are out of reality, and that's at the severe form of the illness. I would like to bring to your notice what is called the postpartum blues or the baby blues, which is just a swinging of mood, which usually occurs about 2/3 of women naturally after they give birth, and it peaks like around the 4th day to the 6th day, and by the 10th day of the delivery of the child, it would have weared out. And what you see usually is just this mood swing, that they are feeling sad at one point, they are feeling low at the other point, they're feeling high and happy at one point, they become irritable, and they just keep crying and having tears. They start crying for no reason. This happens usually to the adjustment in caring for the baby, where you start having difficulty sleeping because the baby is trying to adjust and then you cannot sleep. And it can be explained too that the anxiety to care for that child too is weighing you down, so you realize you are just having mood swing there and there, and you just get irritable. But by the 10th day at most max, it would have wear out. But when we come to postpartum depression, that's like a deep form of that sadness. You can't get out of bed, you can't care for your baby, you can't take care of yourself, and this thing persists so much so that people around will be thinking, why are you not caring for your baby? But you know by yourself that I'm feeling sad, I can't care for this baby. You can start seeing the child as a burden. There are some main risk factors where people can have postpartum depression. If you are once depressed or you're on medication for depression, you are at risk of having postnatal depression. If you have thyroid dysfunction, you may be at risk of postnatal depression. Other things that can cause postnatal depression is unwanted pregnancy in young ladies, and they're still anxious and still worried about how to care for the baby, can suddenly have postpartum depression. If you have unsupportive partner too, it can precipitate postpartum depression. If people are in a violent relationship or no smooth relationship, no confiding partner, most likely you can have postpartum depression. These are risk factors, but majorly the cause of postpartum depression is not known yet, but it can be explained that there's adjustment to the hormones that are produced during pregnancy, and they're trying to readjust to your normal physiology. So when you start having postpartum depression, it is not your fault. It is not because you want to. So don't go ahead blaming yourself. And if you have postpartum depression and it is not treated, it has a relationship to the unborn. And it has been shown that children who are born to mothers who have postpartum depression will have difficulty having relationship due to poor bonding to their mother. You know, when you give birth to a child at first, and the smiles you give to that child, oh, you look at the baby, you're smiling, you are happy about it. These communications are very, very important because it stimulates relationship and the child begins to know you and you start knowing the child. But if you don't smile because you are so involved in the sadness you feel, the negative thoughts have overwhelmed you. If you want to know more about depression, I've done a video previously and it shows all the signs, and then you see all the signs. During pregnancy, I've seen patients like that and they're wondering what's wrong with them, even if they had depression before pregnancy. So you see, when you feel so sad and you are filled with your negative thoughts, you are detached from your newborn. So even if you want to fake it and smile at the baby, the relationship you have with the baby is more than just a smile. All the non-verbal clues like touching your baby, being able to understand when they cry, because these are non-verbal babies, they can't talk, so the cry they give to you are able to tell you, okay, this is time to feed the child, this is time to change the diaper, this is time to, the baby needs to sleep. But if you are all over yourself with the negative thoughts, you won't be able to get this connection, and the baby suffer. So at the long run, the baby can start having malnutrition, you don't feed the baby well, and all of this is enough to cause for bonding for the child. And parents or neighbors who are there taking care of a woman who is just giving birth should please look out for these symptoms, because you have to be at watch to see, why is this lady crying and doesn't want to care for the baby, says that the baby is disturbing, is too tiny and I feel like killing this child, or they just withdraw totally, they don't want to breastfeed the child. This is enough for you to start looking for help, because help is actually available and a mental health physician is always good for you to do that. So when you are there caring for somebody who just gives birth, please let your eyes be wide open for some of these symptoms, because it's real and it's around us. Of course, I mentioned postpartum blues, that wears off like in 10 days. Postpartum depression, it goes home, it deepens, and it can be up to 1 year after delivery. Most maternal depression, especially during and after pregnancy, go undetected. And if it's detected, it is not treated. And this has, like I said, has effect on that baby. And we want a child who is emotionally and psychologically matured, so you don't have to stress yourself. And we need it at the beginning of the bonding. When you breastfeed the child, you are able to smile and rub on the child, and you start having some communications where you understand the need of the child at every point in time. But if you are not involved because of the sadness you are into, then you will lose these chances. And even common in mothers who just gave birth, which we call primigravida or multigravida, people who have had more than 4 children. And this is reoccurring because if it has happened once, it can happen again in the next pregnancy. So when you are planning for your next pregnancy, please try and see a doctor so that you can be guided through your pregnancy, and then you will be prepared for it. And if you have been on medication for depression just before your pregnancy, you still need to see your doctor, because during pregnancy you can now still have depression, and even after pregnancy. So there may be an adjustment for your medication, but of course the treatment is, you need to see a physician who chooses the best for you, because some may be excreted in your breast milk, and then you have to be advised, and then you will be involved in it. Don't be carried away by the myth of postpartum depression, where they will say don't breastfeed the child too will have mental illness. That's not true. This is when your child even needs the most. All you need is people secured around you. But if postpartum psychosis, that is when you are out of reality and you are thinking the baby is evil, or you are thinking so bad about yourself, and you are thinking that maybe you want to kill that child, that is an emergency and you will be admitted. You will still be given the chance to care for your baby, to breastfeed that child, because it's needed. The child needs that breast milk to do well as well. So postpartum depression is real and is among us. We treat it with, and they get better. So if you have had postpartum depression in your first pregnancy, the likelihood that it will reoccur is there. And again, another thing about postpartum depression, it may just be the start of a future reoccurring symptom of depression. If you are not even pregnant at some point, it may just come and you'll be depressed. So these are things you have to look out for. And so husbands who have beautiful wives going through this, your support is highly needed in this period of care because they come out and they do well. Max, within the first 4 months with best treatment, they will be fine and able to carry out their chores and care for your baby appropriately. I hope this has informed you. Antidepressant is used for the treatment, but what you need to know is that the awareness of postpartum depression is very important so that you can get the right treatment at the right time so the child can have good psychological development and everybody is home and dry and happy with a good mental health and a good mental state. Thank you for watching my channel and have a lovely weekend.